Hi, my name is Dr. Dave Cutts.
Hi, my name is Patti Lien.
Welcome to the Standing Podcast. This is organic. This is real. I
Okay.
forget some part. First of all, you were in the dental field, yeah?
Years ago, yeah.
What did you were an
I
assistant?
was an RDA, yeah.
You're an RDA.
hmm
Okay, so you know when a dentist is competent?
Yes. Yeah, I still remember. You remember those things.
Yeah.
And the staff, you look for things.
Yeah. And after dentistry, what did you do?
I got into the veterinarian field.
And how did you make that switch? How did we lose you?
I loved animals.
Oh, okay.
And so, and actually, I used to do the teeth cleaning on the animals with a little bit of
Really?
Cavitron. Yeah.
I didn't forget about that.
Yeah.
So you've cleaned teeth on humans and on animals.
Yeah.
What's the main difference? What jumps out of your mind when you think of the difference?
The suctioning is easier on a human. You can't do it on a dog.
I thought you didn't say what I thought you were going to say. You know what I thought you were going to say?
What?
Is that, well, I don't know. Humans can bite too.
Yeah, humans can, but well, dogs are out. They're
sedated.
sedated. Yeah,
Okay.
yeah,
I would think it'd be harder on animals
Yeah.
because of management of them, kind of.
yeah.
Because
But animals are more interesting because they have a lot more plaque and tartar. I mean, you really see a huge
animals
difference.
have more plaque.
Yeah,
than tartar.
they because people come in, they haven't cleaned their dog's teeth in 15 years.
This is going to get good because here's my question. I had no idea where this interview was going to go. So here's my question. So, like, do you have like animal dental hygienists?
There
That's
are
kinda what
certain techs that's all they do because they can sedate and stuff. I couldn't do that. I was just a vet assistant. So, but I could use the Cavitron. I couldn't extract or anything like that.
So this is for all the patients out there that, for all you guys out there that are just tired of being asked by the hygienist I'm talking about, whether you floss 3 times a day and, are religious about your cleaning at home. So do you ever like floss shame an animal? Like what the hell?
We do the owner.
I can see that.
You tell the owner they need their teeth cleaned. They're like you guys.
Wow.
You don't like your dog's breath. You need to clean their teeth.
I had no idea where this interview was going.
I know. I'm sorry.
We're going to cut all this out,
That's
or
fine.
we may leave it in.
That's fine.
That's good stuff. Okay, so that went off in that direction.
Yeah.
We're going to come back.
Yeah, we'll come back to humans.
Let's come back to humans. So, okay, so I got the first. So you were in dentistry for how many years?
About 6.
6 years. Okay, so you were
Yeah.
in for a while. Okay. All right. So, refresh my mind on this. I mean, I know what I did on the bridge, for the most part. But what was the? Oh, I know what I wanted to ask you. What was the history before you came to me? Is your daughter an assistant or no?
Oh, yeah.
No.
So my daughter-in-law was an assistant for a dentist here in
Okay.
Temecula,
Okay.
and I was going to them just because she worked there and everything, and so they felt that I needed a whole I needed my whole mouth done with all implants and everything,
Okay.
and I wanted to get a second opinion. And so I came here to Dr. Cutts, and he gave me you gave me a very different
Plan of action.
plan of action, yeah, that saved me not only money but time and pain, and it made sense. It truly made sense. So
And most importantly, it worked.
it worked.
So far,
As you
it's
see, it worked. Yeah.
Well, it's interesting that I had to ask that question, even though I know you very well. You've been a patient in the past.
Yes.
But I just realized why I had to ask you that question. I have many people who come in with the exact same problem. They've been told they need, and many people do need implants. And to back up, I'm, like the lady right next door to you that I said was getting the same bridge.
Yeah.
Hers is on implants because she's one step beyond where you're at.
Yeah.
So what we did with Patti is we took 2 teeth that supported a long bridge, which they told you that was going to all come out.
Yeah. Yes.
And we were able to basically rebuild the teeth. I did a root canal on the back one. Oh no, I already had a root canal.
Had a root
Okay.
canal. Yeah.
The back tooth already had a root canal, so it's a pretty solid root. The bone was good around it. Why not build that back up as a support? The trick was we used the bridge to form.
Yeah,
I
and you
remember
were able
this.
to use my bridge. You got to utilize that. You didn't have to make me a new bridge. And then you did the build up. I mean, when you extracted the tooth, you
I
did.
remember this now.
Yeah,
Yeah, I mean, this is like MacGyvering, to be honest with you, a little bit, to say the least. How long do you think this is going to last? What's your gut feeling?
a long time.
Really?
I,
Yeah,
yeah,
maybe.
I think I'm going to get a lot of longevity out of it.
What's a long time?
Um, oh gosh, I don't know. I'm thinking 5 years.
That was the number I had in my mind. That's funny. We were both.
5 years,
Yeah,
yeah.
I think you might get 5 years out of it, and then by that time I'll be retired and I won't have to worry about it.
You'll pass me on.
No,
No, I have a feeling you'll still be here.
I will be, but this is for all my patients. This is a good chance to say this. So a lot of you ask like when I'm going to retire and all that. And the truth is I'm never retiring. I will be retiring probably in the next few years from working. I work 5 days a week, 4 to 5 days a week doing clinical dentistry. And I'm realizing, um, really, and Patty, you remind me, you and really all you guys out there, I don't want to pass you on to corporate dentistry to just anyone. So guess what I'm doing? I am hiring young doctors, and the very first thing I'm saying to the doctor, and we talked about this,
Yeah,
is this right
the
here.
heart.
Can you work for the benefit of the patient and put the dollar aside and out of your mind long enough to diagnose and treatment plan and do the least you can do to get the job done for someone? I mean, that may sound funny. I'm going to get criticized by dentists for this. What do you mean, do the least? Are you shortcutting? Are you half baking it? I guess
No,
is the term.
no.
I'm not talking about half baking it. I'm talking about just not over-diagnosing. When you have this option here that costs $20,000,
Yeah.
and then you have this. By the way, that was going to cost you
Got
20,000. Yeah.
20,000. Yeah.
And what did you pay for this? I forget.
Um,
2,000?
it was yeah, under 2,000.
Under 2,000. God, I should have charged you more
Yeah.
than that. What the
And
hell was I
yeah, and let
doing?
me just say as a patient, um, what he's going to be doing with younger dentists, there's a huge need for that because you come out of school and you know how to do dentistry, but you don't know how to look at that person individually. And we're not a big clinic. We like coming into a practice and feel like our feelings matter. My financial.
Yeah.
I was very honest with him. I said, "This is how much money I have. I'm in retirement. You know, this is what I have to work with." And Dr. Cutts
Which
worked with.
was all bullshit, by the way, because I knew that she got a big settlement from her fourth husband.
No, it was my fifth.
Fifth. Okay, fifth husband. She's a total gold digger. Take a look at her.
I'm Italian. I'm Italian. No,
Italian.
no, but seriously, as a patient, I know you're feeling what I'm feeling because we see it in every area of our lives. At the vet field, we take our dogs to the vets and they say, "Oh, it's $15,000 and to keep your dog alive," when you know it doesn't always cost that much. And it's like that in dentistry. And he listens. He truly has a talent and an ear to listen. And yeah,
Wow.
he really does. He has a heart.
I'm
And you can't teach that. That's something you cannot teach.
I'm gonna have to cut her off here.
I know. I could really go on because it really isn't something you can teach. So for you to take your I don't want to say senior years, but for you to take the time you have now and invest it in young dentists and give them that wisdom is remarkable because you're leaving a footprint that might not be filled, you know. And so
Wow.
us senior, and we're senior, you know, I'm six, we need to leave
We're the
something.
same age, aren't we?
I'm 68. You 67?
Yeah, I'm older than everyone now.
So to leave, so that's important to leave people.
Charles, this is exactly what we were just talking about. She gets what we are.
Yeah,
we get
young
what we
people
are.
don't. You know they need to use our wisdom. They need to use your wisdom.
So what you just said that we're going to use, there's so many multiple layers of usage, but like, you know, I'm about to embark I'm about to go out into the dental profession in a broad way and talk to young doctors. And just, I mean, you already know this, but just to put a little detail to this, the young doctors, I'm on the websites and the whatever chat rooms of the young doctors, because I'm trying to get a finger on the pulse of how young doctors are thinking, young dentists in this case. And I don't know if that much has changed, but it does seem like the student loans pressure is on them.
Yeah.
So you guys out there, if we're making this,
Yeah.
my point, by the way, is that I appreciate what you're saying, because I want you to say it to the doctor, and you are. You're saying to the doctors for me what I want to say to the doctors, and that's huge. But anyway, doctors, you're hearing it from Patti, but I hear it all day long, every day. And if you're ever wondering whether you have to just settle for going into corporate dentistry, and I really want to hesitate saying that I think corporate dentistry can be good. And if you go into corporate dentistry, I want you to go in and do it the way I think you could. I think you could do this in corporate dentistry. You might get pressured by your bosses, your office managers, or whatever, but if they see the results, which is if you do this, then this comes. This is our little saying.
Yeah, it'll come.
The money will come one way or another, and that's going to be our message, by the way.
And you know, for young dentists, don't be afraid to put your own little brick and mortar out there. You know, compete with the big guys. You know, get in with another dental student and open your own little. I mean, that's how it used to be done. And
you still think it can be done?
I still think it can be done. And if you do go into a big clinic and you're hired and you see a thermometer in the lab that says this is how much money we have to make, it's not a very good place to be.
Can you?
No, I'm saying because they have big overhead. You know, big clinics have a lot of overhead. Where if you put a little shingle out, like old school, and put a couple of dentists out there and you open up a small dental building, that's how you started. You know,
and that's what so I mean, some of you doctors, I want you to come work with me, but many of you are going to be in other states and other areas where I'm not. I'll help you. I mean, I want you to be able to put your shingle out. There's a way to do it. I'll say that much. Okay, so there's a way to do it in this new market and be successful. And like, share, whatever. Contact me, email. I'm looking at my producer right now, but I'm not a pro, honestly, at making videos, but I am a pro at one thing, and which is letting, what Patti just talked about. I'm not the greatest dentist in the world. I'm really, really good at a lot of parts of dentistry, but what I think my calling is to point out to you guys the direction to go to, how to be successful. Now, like Patti just said, you can still be successful in private practice, but you really, really got to do it right. And I'll be happy to help anyone, anytime. I don't charge for this.
Yeah, pick his brain. There's a lot in there.
I just want the next generation of the young doctors. I want you guys to enjoy what I've enjoyed, which is just having this and this. So like, share, contact me. I'll be happy to help you anytime. Actually, Patti's going to be on my advisory board. And can you imagine?
I would love that. Yeah.
You would be.
I want all the young people coming out of school to be succkussful, because that's what you paid for. You paid for your schooling. But you know what? Learn from these guys, because Dr. Cutts has been around for a long time, and he's got a lot to share.
We're not even charging for this.
No, it's fine. I could do this all the time.
You could. I mean, you're on the patient advice.
No, I totally could do this all the time.
All right,
this is great. Hey, thank you so much. I love you. Thank you.
Really.